Thanks for listening to the Granite List.Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List.Live, and I'm your host, Sally Pace. Today, I'm joined by Bruce Roffé, who is the President and CEO of H.H.C Group, and Bob Serber, who's Vice President at H.H.C Group. Gentlemen, thank you for being on today.
Thank you.
So let's start by giving an overview of what the H.H.C Group is. Bruce, do you mind sharing?
No, not at all. And thank you for your time today. Yes, H.H.C Group, we really focus on three areas of our business. The first area is cost containment. We're involved in several different cost containment parameters here, from negotiating both in and out of network claims, repricing claims through PPO network partners, Medicare reference-based pricing, and bill reviews where we actually review a claim line by line, and we determine usual, customary, and reasonable fees. So that's the first portion of our business. The second silo of our business is related to independent reviews. We are a URAC accredited and certified IRO independent review organization. We currently do work for 32 or 33 different state governments and commercial payers. And in that work, we act as an intermediary between when a patient requests a procedure to be performed and the insurance company has denied that procedure. In that work, what we do is we will do an objective, non-biased assessment of the patient's condition. Both parties submit medical records as well as background information that would be helpful for us to know. And then we send it out to a board-certified physician in a like or similar fashion to the physician who's requesting to perform the procedure. The third silo of our business is we're an independent dispute resolution entity for the state of New York. And in that work, we act as a mediator between a provider and an insurance company. And it's an objective assessment of between what the provider has charged and what the patient or what the insurance company has paid. So in that work, we do a line-by-line review, and we make a determination as to whether or not the insurance company has paid enough or if the provider has charged too much. And then we render a decision, and then both parties are obligated to fulfill that requirement. So here at H.H.C Group, those are the three things that we do.
And you've been doing it for 30 years. So can you talk a little bit about how H.H.C Group services support brokers and their self-funded clients specifically?
Yes, we work with brokers all the time, and the biggest issue is when their clients, their groups have problems with a very high cost claim that might have gone to stop loss. And we work with brokers in that regard. We also do reference-based pricing. The TPAs that they might refer their groups to, we have the ability to support and provide a repricing product. So we work with brokers all the time, mostly from a cost containment side, but we can also do a clinical review and independent medical exams to make a determination as to whether a patient is still appropriate to receive the care and therapy that they've been getting.
That leads into my next question about medical review and medical billing. I'm curious, you all are on the front line of all of this. So what trends are you seeing right now in medical billing and provider behavior that brokers need to be aware of?
Healthcare costs continue to spiral up. The projection this year is that it might increase 8 to 10% over the previous year. We're seeing costs go up, and it's not unusual for us to see $1 million claims or greater. So things are just changing dramatically. There's also changes in technology with the genetically engineered drugs that are on the marketplace today, and so on. So lots of things are changing in healthcare, and as they change, prices escalate. And Bob, can you add anything to that?
First of all, for brokers, part of the added value that we bring is that we have highly trained attorney-led negotiators, and they are able to help groups minimize or reduce, pay only an appropriate amount for their claims. And we do that for both in and out of network claims in ways that go beyond what we've seen from other people. And so for a broker, it's a way to deliver more value for their clients by having specialists like us do that work for them in cost containment. As far as the large dollar claims, this works in two ways for the broker. One is if we can take that claim and keep it from ever going to the stop loss carrier, then we're helping a group avoid higher costs next year because their total claim dollars and their spend is not as high. They don't get as many spec claims and they don't hit as high in aggregate. And those are some of the ways that we give brokers an advantage versus their competition.
And Bob, can you give us either an example or a success story of what that might look like for the large dollar claim?
What that might look like is we have a client in the Midwest. We average probably at least 12 to 15% for in-network claims below the PPO.
I think that brokers really, in this regard, as Bob said, the average savings below, if we're doing an in-network and trying to negotiate an in-network claim, we're seeing savings of anywhere between 12 to 15% below the PPO discount. And if we're dealing with an out-of-network claim, the savings is usually pretty high. It would range in the 35 to 40% range if we're dealing with an out-of-network claim. And our success rate is rather high. On out-of-network claims, for example, our success rate is for every 3 claims we receive and we negotiate, we're successful 2 out of 3 times. So the savings can be great. We've been very successful with many providers around the country.
And on the website, we just put up a claim that's a trigger code claim. Now, trigger codes alert payors and groups for therapies or treatments that are going to and patients that are going to cost them a lot of money so that we can get control early in the process. In this case, the billed amount was $120,000. The PPO discount was just below $90,000, so it already had a 25% PPO discount. We negotiated that claim down to $30,000. So we saved that group an incremental $58,000 on that claim. So that was 66% below the PPO network allowance. And there may be automatic systems that use PPO networks, and they'll just say, okay, we got the PPO network, we got the discount, but we find to get below the PPO discounts. When we're doing that on in-network claims, the success rate is not quite as high, more in the range of 30%, 1 out of 3. But the savings are big because these are normally large claims. So that's the kind of savings that we can bring.
Without giving your secret sauce away, are you able to share how your team secures those additional savings even on in-network claims?
Yeah, well, we have a proprietary database that we've been developing over the 30 years we've been in business. It not only tells us what charges the provider charge on average for that particular disease state or diagnosis and the procedure, but also tells us what a reasonable reimbursement rate might be for that. We also have the ability to know if the patient were a Medicare patient. We also have the ability to know what Medicare would have paid on that specific claim. So we use all the information and the data that we have to have a conversation with the provider, and in essence, use information and data as our tool to be able to convince the provider that their charges are escalated and too high.
Along the same way, we have databases and historical data from previous negotiations with those providers. Over time, our negotiators have built an understanding and built relationships with the providers so that we don't just go in and beat them up. We go for what's appropriate. And so they take our call time after time, and they'll negotiate with us time after time. They're asking what's part of the secret sauce, and it's that knowledge of who the right people are at the providers and what's a reasonable amount, and they'll understand, they accept.
That leads into my next question. And of course, data is king. It is the topic of the day. Everyone is seeking or chasing data, depending on which side of the fence you fall on. But tell us a little bit about what HHC's approach is and how it makes you different to reference-based pricing and also bill review. How does that set you apart from some of the other vendors out in the landscape?
On the reference-based pricing side, our program is like similar to a Chinese menu. We can do as much or as little as the client would like us to do. So when we do a line item bill review, we're literally looking at every line on that claim and listing every line and making a determination based on the data and the information that we have as to whether that charge is reasonable or not, and if it's not reasonable, what it should be. So we take a rather extensive look and a very detailed look in both instances. Bob, would you like to add anything to that?
In the reference-based pricing area, there are certain patients who qualify for Medicare, and those are end-stage renal disease patients, and they're receiving dialysis. We reprice those claims based on the appropriate multiple of Medicare. And what's unique about our program, as you were asking, that means greater savings for the group and a greater benefit that the brokers can bring, is that we only charge a flat rate of a couple $100 a treatment, whereas these claims, these patients can cost $800,000 or $1 million a year. They're getting dialysis 3 times a week, and it costs $6,000 to $8,000 a time. And so if we were doing it on a percentage of savings, cost to their broker's client is much higher than our low per treatment cost. So it's another way that the broker can target in on high dollar patients and claims and save their clients more money.
I want to turn to independent medical reviews. And can you give our audience kind of a independent medical reviews 101? What is it? How are you helping payers ensure fairness and medical necessity? But will you first educate us on what it is?
The way it works is that a patient goes in and they want to have a treatment, or they've been denied by their insurance company for some treatment that they believe is necessary and their provider believes is necessary. We are a very objective, unbiased referee in this. In fact, we're the judge. And what we do is we take all the medical information and we send that to board-certified physicians of high quality who are on our panel. They then review those cases and they make the determination of whether or not the insurance company should pay for that treatment. And we're very fair, and it shows, we end up slightly more maybe for the payer and slightly less for the patient. And then sometimes we end up splitting it where we think part of it is approved, but part of it should not be. But it's very objective. It's very evidence-based. Everything is evidence-based, so that it's factual, and therefore it stands up to scrutiny.
There are 2 D words running around in our industry today. One is data. The other is disruption. So I'd love to ask you guys, what advice do you have for particularly the broker consultant community that is trying to help clients cut costs, but they're trying to do it without disrupting benefits?
I would say it's really important to have a broad-based system in place that includes case management, a really transparent PBM that might be servicing their client, as well as a TPA, a good TPA that you can count on to do the right thing and do the right thing all the time. And you want to make sure that obviously whoever they use for cost containment is doing what's in their group's best interest in an effort to save anywhere that they can. So, from my perspective, it's really not necessarily one service that can provide them with overall quality and cost, but it's really a team effort based on all the different groups that the TPA brings to the table.
So I know, neither one of you have a true crystal ball, but you are sitting on the front lines of this activity. And so I'm curious what you see changing in the cost containment landscape over the next couple of years. What are you seeing? What do you think we'll be seeing in the industry?
That's a really, really good question. And I wish my crystal ball was better than anybody else's. But what I do see is costs continuing to rise. I don't see any relief for that in the near future. I see government getting more involved in this whole process, either under the Affordable Care Act or the No Surprises Act. I think there are lots of pressures on brokers, on groups and TPAs and so on regarding even new legislation and reporting requirements that everybody's got to live up to. I see things getting more difficult over time, not necessarily easier. Unfortunately, the broker is the one who has to be able to deal with all this. And there's also tremendous competition, so that to keep costs down. So, Bob, how about you?
Yeah, I think that AI is going to be a very important factor. It already has been. There have been a lot of programs that have been set up using AI by the insurance companies that ended up with a lot of denials, and they're working their way back on that. But I think it's very important for the broker, if people bring different AI solutions, that they thoughtfully look at those and examine them to make sure that you aren't going to have those kinds of glitches that are going to hurt the patients and hurt the organizations. I think that there's also one area that's going to remain murky, and that is the availability of data. There's a lot of transparency talk and information being put out because they have to by facilities, but the information is so detailed and so different that it takes a lot to determine what is reasonable. So I think the brokers have, like all of us, have real challenges in them with technology that's being used now.
Which is what makes your work so much more important.
Very true. And we think that if you don't accept the easy way, but you accept the way that gets your patients the most savings, that's really the job of the broker. And, we love to be part of their solution.
I can't think of a better way to end the show. I'm really grateful that you all, speaking of partnerships, we're very grateful for the partnership that we have with H.H.C Group and the Granite List. We're really thankful for your time today and the way that you educated our listeners. And so on that note, Bob, Bruce, the entire H.H.C Group team, thank you for what you're doing to keep our industry afloat and keep people coming back for more cost containment solutions. Thank you, gentlemen. We really appreciate it. And thank you to our audience for tuning in to another edition of the Granite List.Live.
Thank you for listening to this episode of the Granite List.Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.